really great pleasure to have everybody around the world and USA to join this meeting. Tonight, we're going to talk something which is different than what we learn in the medical school. We're going to talk about business of medicine, and we have expert to tell us about that. I just want to tell you that when I went to medical school or when you went to medical school, we never learned business of medicine. We now, we enjoy taking care of patient, going to a hospital, work hard, and then suddenly we realize that we are not making value for our practice. We are making value for the hospital and the insurance company. And what has happened to us? So in last 10 years, we have seen people are leaving the independence and going to the hospital and to insurance company. So the number of independent physicians continue go down. So suddenly I realized that it is not good enough to be a good doctor, low cost, high quality physician. You got to be a good businessman too. So before, if you tell some physician, they say you are a good businessman, he get offended. Is that right, doctor?
Yeah, yes.
You will get offended. I was told one time I'm a good businessman, I got offended. But I think it's now in this world, it's a way of staying independent. If you are not a good businessman, it's very difficult to stay independent. So tonight, we're going to talk about the business of medicine and how you can take advantage of leaders in Palm Beach. And we're going to talk about them too. Dr. Arthur, Dr. Lane, we're going to tell us about that, what they can do. So there is a hope for independent physician to learn business of medicine. So I would like to talk to Dr. Parikh. See, you are a cardiologist. Are you a businessman?
Yes.
Yes, tell us about that.
I have a group of doctors with us. We have 13 locations in Atlanta area and 30 providers in our group. And over the years, we came together and worked as a team. And there is no ownership by me. We all own our practices, but we are together. What we realized is that when I was independent, there was a scarcity in 1994 when HMO came, managed care came, that I may be deselected from big insurance plans. And at the time, with the fear which in my mind, I started acquiring the practices. And then there was a critical mass in Gwinnett County of several practices with me. I was not fearful, and I was able to have a contract negotiation with health plans. And that laid my path to, at one point in time, I had 19 practices, but now we merged several practices together for cost efficiency. And so that's the business part of medicine. And then I joined Doctors ACO. I realized the business part much better. And now I am going to be participating in IPA. Thanks.
So let me tell you what happened. A story about Doctors ACO. About six years ago, a friend of mine came from Palm Beach. He said, why don't you do the business of medicine? So that business of Doctors ACO in the last 6 years has become a multi-million-dollar business. We have saved multi-millions and distributed among the physicians. One of the physicians are here. So Dr. Maria Visitacion, tell us about, she is our primary care physician. She's part of the ACO. Tell us what ACO has done to you.
Hi, good evening, you all. I'm Dr. Claire Visitacion. Okay, hold on, let me. Camera, okay? I'm Dr. Claire Visitacion. You pronounce that as Visitation, right? That's my husband's fault, not mine. So I am a solo private practice in Winder. That's around an hour away here. And I, just like everyone else, I started the practice from scratch, not knowing anything about business. The same year, because I was so curious, I took an MBA degree as well online and did that together with, building the practice from scratch. And with that, I really wanted to stay independent as much as possible and as long as possible. That's why I'm here. I actually started joining the ACO, the Doctors ACO, way back when we started. I think that was 2016.
16, yes.
2016. We did not know, we were 3 years old at that time. We did not know what we were doing. You know, we were just busy building the practice. I was busy studying for a business degree. And the staff of the Doctors ACO helped us a lot, guided us. My staff and I worked hard. And then our first incentive came. And that was a big, pleasant surprise. And as an incentive, it served its purpose. You know, it incentivized us to do and work harder. So the second year, we got another incentive, which was higher than the first, and that made us all happy. And that made practicing or doing private practice really worthwhile. And our story is kind of unique because first and second year, we were really doing great. We were successful. But in the third year, of course, CMS changed the benchmarks. And, you know, since we now know what we were, you know, doing, we now knew what we were doing, we kind of got laxed. And when CMS changed the benchmarks, we had all of the warnings from the staff of the ACO. We still flopped, you know, so we got our lowest incentive for 2019 and learned our lesson. The lesson that I could impart to the rest of the ACO members is actually you reap what you sow. You get what you give. So as physicians, you know, that was our third, fourth year with the ACO. I was laxed in a way that, you know, I let my staff kind of handle it. I detached away from it and then, you know, focused on patient care. But then I realized that, you know, the business of medicine, the business and marriage, well, the marriage of business and medicine actually is intertwined. And we learned that lesson really, you know, sourly by, you know, not getting the incentive that we wanted. So hopefully by 2020, you know, we will get there and get back to, you know, the path that we've always been working hard for. And hopefully, you know, we'll know that eventually late this year. And sorry, I said 3 minutes, but I talk a lot. But just so for non-ACO members and for ACO members as well, there's just one concept that I want everyone to know and remember. If there's one takeaway point that you will bring home tonight, you're already in your homes, but you know that you would remember. I'm visual, so I learn visually. You remember a tripod, okay? Tripod has 3 legs in it. One leg, so the tripod, always remember the tripod. So there are 3 ways in which physicians, independent physicians, are actually getting paid. The first leg of the tripod will be your fee schedule. The fee schedule is actually how we are paid in terms of services. You see a patient, you code it, you send it to the insurance, you get paid with the level, right? And it depends on where you are. It depends on how really good you code your notes, you know, you'll get the fee schedule reimbursement. The second, and you would, you know, in order to kind of negotiate those rates up, you actually need a group for that. And that's where the IPA and the ACO actually would help us a lot. The second leg will be your incentives. So first was fee schedule, second would be your incentives. You probably heard about, you know, the terms or the phrases, close your gaps, you know, quality measures, the quality stars, Yimana, you know, and scorecards. So by closing those gaps and by actually performing well, you get a lot of incentives, and you also need a group for that. You need a collective voice for that, you know, so that's the second leg. The third leg to the tripod is actually the most important, which is good patient care. So when you close your gaps, you actually perform better. Not only that, but you also take care of patients better. You make them healthy. In every visit, if you give out that FOBT card, that's one less colon cancer, you know, for a patient. If you order and tell your patients, you know, do this screening mammogram, that's actually one less breast cancer. So in a way, you're saving, you know, a dad, a mom, a daughter, a son. And that's what the third, you know, and the strongest kind of leg on that tripod is all about. It's all about patient care. And I think the business of medicine, it doesn't have to be business alone, you know. It would be better to actually marry both business and good patient care. And at the same time, the return of investment will be a win-win situation. You know, you take good care of the patients, you make them healthy, and at the same time, you get paid for it because you deserve it, you know, and that's how you stay as independent physicians. So again, the tripod, fee schedule, your incentives, and good patient care. And you cannot do those three without a village to help you out, without the community to help you out. And the ACO and the IPAs, they are very, very helpful. I would not have done it, you know, as a solo, you know, family medicine, you know, primary care doctor. I wouldn't have done it through these years without the help of the ACO, actually. So I think that's it. Sorry.
Thank you, Claire.
It's beyond
Claire
3
is the
minutes.
most hardworking girl. I mean, I have to call her, you know, at least 3 times before I can, every time she's working and vaccinating somewhere on Sunday, Saturday. So some of the physicians are still working hard, and Dr. Plaster is supposed to be here talking about it. She couldn't attend because she's still working right now in her office covering COVID patients. So let me tell you about business of medicine. The one person or 2% I want to introduce today, they know more about business of medicine. They are feeling about it, and they're going to go there as Arthur Hansen and his co-partner, Dr. Lori Lane. So Arthur has given this talk before, and I have listened to it. Basically, my goal is to deliver what he's looking for. He's looking for critical physician mass in each county who are willing to put their cash so he can show them how to make real value to their practice. Arthur is the Chief Executive Officer of Palm Beach ACO, which is #1 ACO in the country. And Dr. Lane is his partner, and she basically know how to turn around ACO. So now they are specialized people who are failing ACO, come to them and say, listen, turn it around, and Lane will tell us how she did that in California. So first, Arthur, go ahead, or Lane, you go ahead, whoever want to go first.
Hi, Dr. Agrawal. I think, I guess I'll jump in. I don't know if we can get our slides up, if that would be possible.
Sure.
Thank you, Dr. Agrawal. Thank you, Dr. Parikh. You guys have done an amazing job at Doctors ACO, and what you guys have put together is an incredible organization of like-minded physicians to get the job done. Hats off to you, and I think you guys are on the right path to continue the journey of controlling our destiny as physicians. That is our goal. Our goal is to stop being pushed around by other entities, big business entities, hospital entities. We really, really need to get these platforms organized, get us together, and take the step to contribute to our absolute independence with a very, very nice rainbow at the end, which is beautiful equity that will create lots of, hopefully, and should create true wealth, because we've created it for almost every other, or actually every part of the healthcare industry. The wealth has been created starting with us. And this image is absolutely true. Us physicians have signed, authorized the entire healthcare pie with our consent. We are the one that have given the referrals. We are the ones that have signed the prescriptions. We are the ones that have begun all the continuous payments of the healthcare dollars. And can we go to the next slide, Dr. Agrawal? This slide says it all, like no other slide. $3 trillion goes to healthcare annually. And if you look at this pie chart, the physicians are 10% of that pie chart. We get 10% of that $3 trillion. thinking about it may sound like a lot, but if you look at from the true perspective lens, it's not, because that 10% gets all the blame. We always are the ones that get blamed for healthcare costs for the entire pie. We are the ones that always are the first to be at the firing squad, and we are the ones that run healthcare. Yet we are 1/10 of the pie, and in my opinion, that's too low. Hospitals, what do hospitals do? They're getting 38% of the pie. That's too much. It's simply too much. Nursing care services are 8%, home health 6%. That's too much for these people. And I don't even know what other is for 18%. That's probably another black box that nobody knows where the money goes. But the reality is, our goal is to increase our 10%. We should be higher, hospitals should be lower, and every other section of this pie should be lower. We need to turn it. We believe in Palm Beach County, where we are, where Palm Beach ACO is, we have started to turn this, and we have started to increase our physicians' payments in multiple ways. And it's increased, and we are confident that we are higher than the 10% locally. And we need to keep pushing this nationally. And health, and let's just talk about hospitals again. What do hospitals do? Hospitals take the money and they give it to Wall Street. And they are so organized and so good at charging, overcharging, getting all their money, going after every dollar, because they are organized to that extreme extent. You look at the last 20 years, what has happened to our fee schedule? We have gone down, yet the operating room costs have gone up 10 times. The emergency room services costs have gone up 10 times, yet we have gone down. There's something wrong with that, because they have better lobbyists. In any event, our goal is to increase our pie, and that's what we're about tonight. We need to focus. We need to forget about local rivalries or issues. We need to band together, because there's strength in numbers, and that's what we are about. Next slide, please. So Palm Beach ACO, I'm just going to give a quick overview of our local organization. I apologize if many of you have seen this before. Next slide. Our mission is to provide, we have a noble mission. We want to provide the right care to the right patient at the right time. So we're not about withholding care for our patients, but we are about accountability to the providers, to the hospitals, to the home health, to the nursing home agencies, that if they have our patient, they need to fix our patient the first time. They need to keep our patient the appropriate length of time. If it's a hospital, they get paid a DRG. They should not begin discharging that patient the day they are admitted. It's not their decision to worry about discharging the patient. The decision to discharge the patient is the appropriate hospital doctors, the hospitalists, the admitting physicians. That's what we want. We want that patient to stay maybe 1 or 2 days extra and then go straight home, rather than end up going directly to a nursing home and the patient is somewhat already sick because they were discharged early with a high potential of going back into the hospital. So we're very okay when patients get admitted to the hospital if they need to be there. But we really want those patients to be treated appropriately at a higher level of care, not like they used to be where nobody is watching, because now we're watching and we have a choice. If your hospital is not working good for us, we want to move our patients to the hospital down the road, the one that's going to work with us and do what's best for our patients. Next slide. In PBCO, our organization, we started it in 2012. We're 100% physician owned. We're not owned by, we have no ownership by any hospital, any insurance companies, or anything. And we work for our physicians, and we look at ourselves as a think tank of physicians. We do what our physicians want. And we're happy that we got to the stage that we can spread what we've been doing in Palm Beach to other areas of the country, like Doctors ACO. Next slide. Our success has been very good year over year because we are energized and our physicians have come together to do what's best for the patient with our key philosophy. Like I said, let's do what's best for a patient at the right time. When we have gotten a tremendous amount of data from the government and we have basically peeled that onion of data to give our doctors actionable intel of where the patient's best dollar is spent to get them healthiest and stay away. Very successful we have been. We have saved millions of dollars for the Medicare Trust Fund, and we have distributed year over year tens of millions of dollars. In 2020, our last savings, we're projected to distribute $50 million to our physicians. We have currently 93,000 Medicare fee-for-service patients that we manage in Palm Beach County. Next slide. Out of the 562 ACOs nationally, we are ranked number one. We have saved $470 million to the Medicare Trust Fund. And over the past 9 years, we have distributed $230 million. I'm sorry, 8 years, $230 million to our physicians. And we're proud of that number. And look what the value-based spend that we have is $1.7 billion, meaning that our physicians in Palm Beach ACO that are in our organization with their pen or with their EMR lock button controls $1.7 billion in spend. That's a lot. That's a lot of power us physicians have when we're organized. If it's one doctor, obviously, nobody looks at them. But when we're organized and we have critical mass, the other healthcare institutions now listen to us. They want our business. We want to give them our business if they're going to do it right, if they're not going to just do social admissions. I mean, we had one hospital locally that was admitting 90% of our patients that hit that emergency room were being admitted. And then down the street was 60%. Unbelievable. Now we're at about 33%. That's better. But the difference is uncanny if it goes unchecked. And now that hospital was that 90% is still about 45%, still high compared to the others. But competition is good if you do it right and you manage it right. We're not in the business of picking any fights with these hospitals. We're in the business of managing our care. They all want to do the right thing. They all at least say they want to do the right thing, but let's show them the data. And it goes back to the point of being organized. And if we're organized and we have critical mass and you get tens of thousands of Medicare assigned patients together that you control and you manage, hospitals will listen. Home health will listen. Nursing homes will listen. Everybody will listen. But we got to get together and stay together. Next slide. Next slide, please. Dr. Agrawal. So we talked about this. We are extremely data driven. Everything is data. We find the data points that make sense and we show them to our physicians. We never tell our physician, you must use this hospital, this orthopedic surgeon, this. No, we just show them the dollars. And we show them not just the dollars, the quality, the readmissions, the recertifications, the high level of potential abuse that happens. It all has to do with the data. I could tell a doctor till I'm blue in the face, please do this, but it doesn't click until we show them the data. And that's what's great about the last 10 years is we've gotten to the point where we can get data in real time, just about. We can get data in all the claims, everything, and we can put it together in such a way and we can find all these issues. And the government has been really good with ACOs because they're like, listen, we've been trying to control costs for the last 30, 40 years. It's not working. But now, if you doctors can help us, we will share that savings with you. And that's what they have done. They have become finally genius. That's one thing they did right. And they allowed us to get organized. And nobody in a restaurant knows the food better than the chef. Nobody in healthcare knows healthcare better than the physicians. But we have not had the opportunity until recently. Next slide. This is just one of our meetings that we have, and the enthusiasm of our doctors. This is on a Sunday morning, I believe at about 8:30 in the morning. But our doctors are, again, energized. They believe in the purpose, they believe in the mission, they believe in the cause, and they do not want to end up being employed by a hospital, because that's what happens when doctors cannot make it on their own. We are a vehicle for information for our physicians. We are a vehicle to help them, guide them through the turbulent healthcare, because there's one thing constant with healthcare is change. It changes too fast all the time, and the little guys get cut out. Next slide. So when we started in 2012 and our first year was ended 2013, 32% of our primary cares achieved shared savings. In 2019, 6 short years later, 84% of our primaries achieved shared savings. Therefore, we're on the right direction, and we have a formula for continued success, and it will continually, our goal is for that 84 to be 100%, but it's getting there, and it's nice trajectory that our doctors are energized to do the right thing. Next slide. So now I want to talk to you about what we're doing in Palm Beach, and I hope you embrace this, and I hope you allow us to do this in other markets. We have 93,000 Medicare fee-for-service patients assigned to us in Palm Beach. We touch about another 30,000 that we actually see but not assigned to us. Every year we lose 5, 6, sometimes 6.5% of those patients end up going to Medicare Advantage plans because of social economics. Medicare Advantage plans, the government is pushing. They want them. They want the patients out of fee-for-service as fast as possible, and the trend is going up and up. Nationally, in 2019, 34% of Medicare beneficiaries in the entire United States are in Medicare Advantage plans. And in 2020, I believe that number is close to 37%. So every year it's going up. So if it continues on this trend, in another 10 years, this may be, 60%. 2/3 of your Medicare fee-for-service patients are going to be potentially in Medicare Advantage plans. We want a piece of the action. I don't want to say we're greedy, because we're not greedy, but we want a piece of the action. We want to do it better, and we want some of the benefits of being part of an insurance plan. Next slide. In Florida, you see it's 43%. In Georgia, 36%. In New Jersey, it's all the way up to 41%. And 30% as well. It's going up everywhere. So nationally, it is going up. We want a piece of it. Next slide. We in Palm Beach have crossed over. Our physicians in Palm Beach ACO have a joint venture and created an insurance plan. We have created Providence Health of Florida, and we went live 1/1/2021. And that's a few short weeks ago. And what that means is our physicians are part owners of an insurance plan. And the barrier is very, very hard to become an insurance plan. And if I look at it, that insurance companies make this barrier very hard to keep everybody out, to keep us out. And it is a true blessing that the government has not included insurance plans under Stark. Meaning, what does that mean? You're not allowed to own a physical therapy agency and refer to them, but you're allowed to own an insurance plan and refer to it. You're not allowed to own an imaging center and refer to it, but you're allowed to own a Medicare Advantage insurance plan and refer to it. With all of all the Stark issues, insurance plans are exempt. We have 160 primary care doctors in Palm Beach County, and another 200 specialists in Palm Beach County have invested and raised money to own this insurance plan. We were smart enough to know what we know and what we don't know. What does that mean? We know we want to do an insurance plan. We know we can send patients to be part of this insurance plan. We know the product that we want. We know how to make it better, but we don't know the back office. So rather than us, and we don't know the regulations and compliance, rather than us build it from scratch, what we did is we merged, or we have another company that helped us do it, and they have ownership as well. But we have the majority of the influence and the majority of the structure to do this. We are hoping that this will be the first phase. We are hoping we can learn this really, really good and take this to other parts of the country where physicians have ownership in an insurance plan. And why do we want that? We want it definitely for another bite of the apple. We want it to prove that we can have a better delivery model to our patients with it. And we think we could do it with more cost effective. Our money doesn't need to be spent all over on advertising. Our money doesn't need to be spent to suffice Wall Street. Our money needs to be spent on our patients and our physicians. So there's a lot of money that could be there, that is there for a good product in insurance plans. Next slide, please. Now, this is very interesting. I just want to show you how much you guys with your pen have created wealth to other Medicare Advantage plans. Clover Health, it's a Medicare Advantage plan out of New Jersey. I believe it was started by a cardiologist. It has 54,000 lives and is valued at $9 billion. Oscar, 20,000 Medicare lives valued at $4 billion. Cano Health is not even a Medicare Advantage plan. That's an MSO. That's the subsidiary. What they do, they take a cut. They're like bookies. They take a piece of the action. Now, they do provide a good service, and I'm making that simple, but they provide a piece of the service. But once they train you, they have continual equity. Continual residual money coming in after they train you. A new practice comes in, they train them on Humana, they show them all how to do the Humana, et cetera, and then after a few months, you're good to go. But they continually, for the rest of your period that you're with that Humana, they're taking a cut, 25, 30%. In our insurance plan that we've created, there's no middleman. There's no MSO in between. We don't need it. And we want to save those funds for our physicians and our patients ultimately, because it needs to come from somewhere. Devoted Health, also 16,000 members, $1.8 billion. The money is crazy, the valuations of this. There's another whole presentation of how we in Palm Beach created the distribution model and how the physicians have an exit strategy to get out when they want to, because let's face it, all our doctors may not want to get out at the same time or sell at the same time. Everybody has their own. And the owners, this is a true investment when you create this. It doesn't mean you keep it only while you practice. Our doctors in Palm Beach are planning on retiring. And when they retire, they can give their asset of the insurance plan to their kids. They can sell it, they can exit, they can do whatever they need. And our valuations are going to be staggering, we believe, in Palm Beach when we get our footprint and we get traction and we do a good quality job and our physicians are energized. But again, if we don't do it in Palm Beach, we're giving that value, those billions of dollars, to another entity like these people. Why? When we can do it ourselves. They have told us for years we can't do it. They have told us for years doctors can't get organized. They have told us for years doctors aren't the ones to save money in healthcare. That's not the case. They've been keeping us down. They want to keep us down. They want to own us. They want us to work for them. Hospitals, number one. And when we work for hospitals, the cost traditionally goes up 25% on patients. That's a fact. We cannot be held down any longer. We should not be held down any longer. We get all the good publicity and the bad publicity for the entire healthcare. So we should take control of our destiny. And hats off to Dr. Agrawal. Hats off to everybody who's putting these presentations together, because we're in it together and we need to save our healthcare dollars because it's a virtuous cause and we need to benefit by saving it, being smart. Next slide. Thank you very much. I appreciate the time.